Good morning, and thank you for this opportunity to present to you. As Simon mentioned, I'm a member of the coordinating group for the Victorian Active Ageing Partnership, which commenced in October of last year. And one of the important early things that we've been concentrating on is investigating what are the things that are important to include in the way that programs are designed and delivered so that they're attractive, they're accessible, and they're engaging of older people. So that's what I want to present to you this morning. Now, in your pack, you'll see there's a one-pager in there, which is a summary of the best practice framework for engaging older people in physical activity, and I'll refer to that at the end. And what I'm going to be doing in this short presentation is explaining to you the steps that we took to develop that best practice framework and the thinking that was behind it. And I want to acknowledge my other coordinating team members, Jen Nolan and Renee De Silva from Move Muscle, Bone and Joint Health, and David Menzies from Fitness Australia, who've been part of this work. So there's been quite a lot of research that has been undertaken about the barriers and facilitators to physical activity for older people, and Kathy presented to you a really significant summary of that evidence and highlighted things such as physical limitations, accessibility, costs and location, social support, timing, competing priorities, and a range of other things. And that's all very helpful information for people to be aware of in the way they think about designing and delivering their programs. What we were concentrating on in this particular review that we did to develop the best practice framework was the experiences of program deliverers, direct providers, leaders, and also the organisations that deliver programs in regard to what they've found help to overcome some of these barriers in practice. So that's the area that we've recognised is important for providers to be up to date with, to help them to reflect on what they're doing and to improve engagement with older people. So to be a little more specific about what we did, when we investigated this topic, we did a literature review, and we were focusing on programmatic, which means program design, facilitator, and organisational factors that are associated with attendance and adherence at group-based physical activity. So we're particularly focused on general exercise, strength training, aqua fitness, tai chi, dance and sporting activities, those that are conducted in a social and structured environment, which I think many of you are working with. So we reviewed the literature over 20 years, and that included not just scientific studies but also evaluation reports from people's work in the field. We included qualitative studies, which is hearing people's opinions, and quantitative studies, which is looking at numerical and statistical associations between particular characteristics and attendance and adherence. And then what we did was, once we generated a list of things based on that review of literature, is we sent it out to a range of organisations in Victoria, and we had 15 who responded to us to rate from their experience how they considered the importance of the things that we identified through our literature review. So, very quickly, we didn't get as many titles, fortunately, as Kathy did in her review, but we looked at the same databases. We ended up with 105, mostly scientific studies and a few reports that we read in depth. And then once we excluded those which weren't directly relevant to the topics that I've told you we're focusing on, we ended up with 28. That included a mixture of the qualitative opinion type studies, the quantitative studies, and those that were a combination of the two. So out of that, we identified 34 influences on participation, be that turning up, which we consider to be attendance, or adherence, which is continuing to participate. And then in our consultation with our informant group of providers, we got some verification of that, which was good, and also we had 6 other things that were recommended that we thought teased out some of the things that were identified in the literature review. So the way we've organised these, and this is to explain the structure that we've put into our best practice framework, is we've looked at them in 3 domains: program design, facilitator attributes, and organisational capacities. And within each of those domains, we've looked at the primary factors, and there were 4 under each. So what we've got is 12 factors as listed there, and I'm going to walk you through each of those and talk about the elements that were identified within each of those areas as being important for promoting attendance and adherence. Now, before I get to doing that, I'll just mention that when we came to look for organisational capacities, those are things like the qualities of organisations and their policies, their procedures and processes. We actually didn't find very much. So there hasn't been a lot of investigation about that. What we did find is that when people did some kind of program and they evaluated it, that they made recommendations for the future about what they thought their organisation should be doing. So really what we were doing was diving into those kinds of recommendations and comments that people were making to list the organisational capacities. All right, so the first factor in the area of program design is accessibility. Affordability, convenience of locations, transport options. Doesn't always mean providing transport, but being proximal to transport, which gives people alternative ways of getting to the program. Varied times, which I guess addresses what Kathy referred to as the time demands that there are on older people and the competing priorities that they deal with, and also cultural inclusivity. And what the literature said was that there have certainly people who report when there's some sort of acceptance of their traditions and their language and their cultural preferences, they feel more comfortable to take part in a group. The next factor is one that really only just reiterates what we've heard many people already say, starting with Jared and others from our panel as well this morning. Friendliness, welcoming, that initial welcome, support, and which means interest and help from other people within the group, and also social opportunities. And here it's not just social opportunities by participating in the group itself, but extra things that might be put on associated with it, dinners, parties and so forth. Thirdly, safety. This was something that rated very highly when we consulted with our advisory group or our informants when we developed our initial list of items. Tailoring the exercise and adapting the exercise in a way that is workable and not in any way going to present any kind of physical risk to participants. So that process of adaptation of the exercise is really important. Another aspect of safety is the opportunity for referrals to additional assistance or additional assessment for people who may be struggling in particular areas and have certain needs. And lastly, something that was mentioned by our informant group that we didn't really think of, it's not really mentioned specifically, but I think it's relevant to safety, is hydration. So encouraging people to bring water or having water available during the program. And the final element of program design is participants being able to experience and observe benefits from their participation. Now, in a short-term sense, that's finding that the whole experience is fun, that it's energising, and I think the comment that was made earlier about music is part of that, so that all adds to the overall sort of enjoyment of the experience. And other aspects of being able to see the benefits, getting some kind of feedback in some way, but feedback from the instructor or perhaps seeing their improvement on a particular measure over time, and also being able to feel and experience some kind of improvement in functioning, in day-to-day abilities to mobilise, to undertake day-to-day activities of living. So those are the first four areas that relate to program design factors, and we've covered a number of elements within those. Now what I want to turn to is facilitator attributes. The first main factor that we've identified is expertise, and this incorporates that the facilitator or the leader of the group is trained. There's not, unfortunately, I guess this reflects the fact that this literature comes from diverse kinds of locations. There's no sort of description of minimal kinds of training or particular types of accreditation, but just the fact that the person has received some kind of training in exercise and exercise leadership is an important factor for participants. That they have broad exercise knowledge, so that there are able to demonstrate that in the way that they work with participants to adapt the program for them, that they can answer questions that people might be having about the ways they should do particular exercise or feelings they may be having. That facilitators are able to monitor how participants are progressing through the program, how they're experiencing the work or the exercise they're doing, and to undertake periodic assessment. And lastly, this is again something that was mentioned by our informant group, not something that was necessarily highlighted in the literature, but it's first aid training, or some first aid skills to be able to respond to any events that might happen within the group. The next facilitator attribute, really, and this one and the one that follows it relate to the interpersonal skills and the qualities of the leader. And first one that we've got here, we've listed, is under the factor of responsiveness, that they're enthusiastic, they display a level of energy in what they're doing, that they personally show some awareness and attention to each of the participants. Obviously knowing their name is an important thing, but I think it was Jan who mentioned up here on the panel that she appreciated that somebody remembered her story, from a couple of weeks before. So that kind of sense of being a person and being known is important. Regular communication with participants, so not necessarily about sort of health things, but just communicating, being responsive to each participant. And lastly, being responsive in terms of adapting exercises during the delivery of the program as needed. And the second factor within this kind of area of interpersonal skills relates to being able to nurture participants and nurture the group. Things that were highlighted in literature were that the leader was encouraging, that they were positive, that they were conveying a message of the possibilities that the participants could achieve, that they were able to generate a fun environment within the group, and that they were able to build a sense of group cohesion. Thirdly, that they were open to hearing from their participants, that they were prepared to be a little inclusive in decision making around the program and the way it was conducted, which I think is an interesting insight. And lastly, and this I think ties in with the point I made earlier in regard to cultural appropriateness of groups, is that there's some cultural sensitivity, some awareness of people's different preferences and practices in regard to exercise and other things that might affect their attendance. Finally, the other factor in regard to facilitator attributes concerns what we've described as being connected. Something that was highlighted by our informant group is that it's important for facilitators to be able to keep up to date about new developments in the way exercise programs are being delivered and adapted for people. So we've written that as receiving practice updates. It doesn't necessarily mean going and doing more university courses, but just being tapped into information and updates that are going on about delivery of programs. Connected to the network of services, just being aware of the services and the supports that are around for participants and other alternatives that there are for them. And thirdly, being able to make use of referral to those services if and when needed. In some cases, when groups are being run by a health professional, that's something that's sort of part and parcel of their role. But if they're being led by a non-professional, it might be being aware of a professional that a group person can be pointed to so that a referral process can be initiated. All right, and finally we come to the domain of organisational capacities and the four factors there. And as I said, this is something that there wasn't a great deal that was written about, but we've really sort of taken from people's comments and observations based on what they've seen in program delivery. First thing is diligence and care. This relates to the values of the organisation. And diligence of care, what we're referring to here is a commitment to quality improvement and a commitment to safety. Secondly, a value of positive ageing. And I think that's very kind of apparent in all of our discussions so far today. But a belief that older people can remain active in all various sorts of ways and live fulfilling lives and be productive contributors to the community is something that the organisation needs to demonstrate in the way that it communicates to its participants. And thirdly, social equity. And what this is referring to is some awareness that there are people with different levels of advantage and different barriers to participation, and being prepared to try and work with people and work with other organisations to overcome some of those barriers. The second domain or second factor in organisational capacities is the networks. And the three factors here are access to organisations or groups where there can be volunteers that are recruited to support program and be possibly trained as leaders. Networks with community groups, particularly groups and agencies which might be in contact with higher needs and more isolated people in the community, to facilitate pathways to participation. And thirdly, networks with health agencies where there can be access to guidance, possibly around refinement of exercises, guidance in regard to how particular support might be provided for a participant. The third factor in organisational capacities is resources, and this encompassed funding to be able to subsidise or reduce the fees for participants so that it's affordable. Being able to access, provide comfortable and safe venues, and that includes venues that are accessible for people who have mobility problems or other access issues. Equipment and storage, having the equipment and being able to store the equipment, not only mentioned in the literature but strongly supported by group leaders. And also the informants that we're in contact with wanted to highlight that change rooms can also be a useful thing, particularly with some programs where people need to put on particular gear in the exercise that they're taking part in. And lastly, the last factor that falls under the domain of organisational capacities is policies and systems. So this encompasses risk management, identifying what the risks are and having procedures in place to prevent those or address them when they arise. Staff development, and that links in with what I was saying earlier about leaders or facilitators having access to information about updates in the field. And thirdly, an interesting one, but came out of the literature, is flexible work arrangements. So a system that allows for the fact that leaders, who may be older people themselves, have varied types of availability, and work arrangements that allow for that are ones that are more likely to be able to sustain their involvement over time. So this is what you have in front of you. We've taken this information and we've put it into the best practice framework wheel. We're calling it a best practice framework, but we might call it an improving practice framework. It's really about providing a resource that providers can look at and they can reflect on and possibly get some guidance for improving what they're doing. And we've listed the three domains that I've talked about as committed and equipped organisations, skilled and attentive leaders, and appropriate and rewarding programs. So where to next with this? Well, what we are doing is we're disseminating this now, and you've all got it in your information packs, and we're also making it available through the Victorian Active Ageing Partnership website. We're wanting to develop a tool, which is like an audit tool that sits alongside this, that providers might use to review what they're doing and identify some potential areas for improvement. And in next year and beyond, we want to also use the content of this to guide us in some training that can be provided to leaders and organisations around improving the attractiveness, the accessibility and the engagement that their programs are able to achieve. So that summarises my presentation for you this morning. I hope that's a clear summary of what we've done to date. And what I'm going to do is, we had a little discussion ahead of my presentation, is instead of opening up for questions from you, I'm going to ask a question of you and invite people within the group, because we've got a lot of experience here, to respond to this question, and that is, what thoughts or experiences do you have about steps that are useful to assist in improving the quality and the delivery of physical activity programs for older people? So we've got a best practice framework that sits here. question that we've got is what kinds of useful steps might be taken in working with organisations and providers to help this to have some kind of positive influence in what they do. And it's quite possible that you've got some thoughts, maybe some experiences in regard to steps that are helpful in improving the quality and the delivery of physical activity programs. So I'm going to open it up now for people to raise their hands, and the roaming mic will find you, and we're very interested to hear your thoughts and experiences.
Hi, I work in partnership with ethnic organisations and bilingual workers who work directly with seniors clubs, and one of the biggest things we hear over and over from the communities, and particularly the Macedonian, Greek and Italian communities, where there's a lot of people who don't have a high level of English, is that they need classes and activities provided in language for them, able to access, and that's a critical factor for their attendance, that it needs to be advertised in their language and provided to them in language. And I witness that happening a lot through ethnic organisations, but I wonder how that might be supported to be offered more broadly, particularly in regional areas.
Mm-hmm. Thank you. There's another hand.
Just to comment, I think that we all work in very resource-limited places, and I like the idea of knowledge of services and referral processes. It may be that we have someone in our particular system who we may no longer be able to work with, but if we know somebody else that we can refer them to in terms of their, either their change in capacity or change in interest, then that's really good, because no one organisation can provide a service for every single older person.
Excuse me. Just looking at this best practice framework, a lot of all the photos, all the activity pictures you had were of people in structured exercise classes, indoors, in controlled environments, with using equipment. I'm just sort of thinking about things like U3As and other organisations like that run very different activities, but are still physical activities like walking or whatever. And particularly in regard to the skilled and attentive leaders aspects. I suppose I've got a feeling we don't want to sort of over-professionalise some areas of physical activity and scare people off from setting up and running activities.
Yes, that's a welcome comment. I think that we recognise a really broad range of activities, such as walking groups, for example. A volunteer leader is quite capable of running a walking group and a number of other types of exercise groups as well.
I think with the program design and facilitator attributes and your organisation capacities that you've broken down into, what I feel is that, we can talk about all this, but how is the Victorian Active Ageing Partnership doing with working with the councils so that there is a standard uniform design that is run for just today I've heard somebody say about Glen Ira putting it in the newspaper, and I've heard someone tell me that Collingwood and Richmond run such and such programs. So it's not really standardised. So how could that be better facilitated so that, the over 55 have got 3 days in the week, and it's between these hours, which I've heard, and it's run and it's worked in partnership, for the people that live in those areas. I would love to know that if it happens.
Yes. Well, those are exactly the questions that we want to be working through with participants today. What steps can we take? We've got some ideas about what we need to do, but how do we take those steps? What can we do? What connections can we make? And what can we learn from each other? Yeah.
I think ask a lot of the instructors who are casual, part-time people, and they often get left out of the loop in the decision-making.
So hear from people who are the direct point of delivery. Yeah. Thank you.
Just down the back here.
I think the networks and partnerships is really vital in this. I come from a clinical community rehab hospital setting where, we're always looking for that next step, for our clients to continue in the community. And so I think next step from the Victorian Active Ageing Partnership perspective, I think it would be very useful in helping to facilitate the developments of those local partnerships, so that we can, set up our own networks. And, that's something that we can initiate ourselves, but if there was kind of support coming from you guys to help facilitate that, I think that's, we talk about the referral pathways and knowing where to send people, the lack of resources, and we can't do everything. Just really developing good networks in local areas. I come from a regional area, so networks in local areas to really facilitate those pathways between providers.
Yes, good, thank you.
And one last question.
Oh, I really like the framework, but I think just following on from that last comment, that it is more relevant to do it in a rather than individual agencies in a partnership manner, and I think that a lot of the work that's been done in the primary care partnerships has kind of edged around that. But having the framework where you could sort of look across a region and say, where are our venues, where are our leaders, and sort of put it all together as a local area partnership, I think is a really good way to apply that. And I think I look forward to seeing the tools that come with it.
Yes, thanks very much. I think that's a good summary comment from what we've covered this morning.
Can I have just one last, Simon? Just people, just in relation to that, I'll just alert people to a presentation this afternoon, which is on an audit and gap analysis that the Victorian Active Ageing Partnership has done, that actually looked at the physical activity opportunities in each Victorian LGA. So that is a start. It's not a complete picture, but it certainly is a start to maybe forming some of those potential partnerships.
Well, thank you very much, Ben.